Hello, my name is Maggie Bubello, and today I will be presenting my research question signature assignment. For my project, I decided to study the question of how ageism affects healthcare. I currently work in a nursing home where there is about 34 residents. Most of them are retired nuns and suffer from some form of dementia. Thankfully, I work at a great nursing home where all my coworkers are very respectful and kind to our residents. However, I know that the situation is not the same at all nursing homes and other healthcare facilities. There are several nursing homes that have issues with treatment of their residents. Why is this important to my career? My major is a Bachelor's of Science in Biology, and I am looking to hopefully study dementia and hospital treatments for it. Dementia is a series of different diseases that are likely to affect the elderly. Some of these diseases include Alzheimer's and Parkinson's disease. Those with dementia could be at risk for being victims of ageism and mistreatment. I have gained an all-around love and support for the elderly since my time working at the nursing home. I have grown to love some of the residents like my own family. It has become especially obvious to me within the past few months how little people care about the elderly, especially during the time of the COVID-19 pandemic. The elderly are the most at-risk population at this time. What I've learned: ageism is defined as prejudice or discrimination based off of a person's age. Healthcare providers are far more likely to be impatient with geriatric patients. This may cause them to over or under-prescribe medication or treatments. This is not only dangerous to the elderly, but it also can be very costly, costing up to $63 billion per year. This stigma continues because many consider the elderly to be a burden to healthcare and to society, because many live on Medicaid, which is government funded. Next, I wanted to show some of the evidence of ageism in healthcare. In a study conducted by Gok Uyghur, it was shown that assisted living associates who went through training in geriatric education had more positive feelings towards the elderly than those who did not. Dr. Bubello estimates that seniors are far more likely to pay more for medical needs than others. Of the 8 most expensive diseases, the elderly make up about $63 billion of the costs for the same treatments. This is about 1 in every $7. Not only is this costly for the elderly, but it is not good for our economy. They are also more likely to be dismissed by physicians who may be much more impatient with the elderly and lack understanding. Another important point to make is the issue of organ transplantation. Many elderly are lower on the list for organ transplantation than those who are younger. This is because their bodies may not be as equipped as younger people to be able to accept foreign organs. However, this does raise the ethical question of whether or not these people have the same right to these organs as younger people. The clearest example of ageism in healthcare has come from the recent COVID-19 crisis. People have shown their clear lack of respect for the elderly's health by lacking social distancing. One woman even reported that a younger person got so close to her without a mask that she became very concerned. Many nursing homes have been misreporting the amount of cases of COVID-19 and deaths caused by COVID-19 in their facilities. The fact that they are able to get away with this, with so many deaths following, shows that there is a clear amount of ageism in the United States healthcare system. Though it has not been proven yet, I'm sure in the future we will hear stories about how doctors were more inclined to help those suffering with COVID-19 who are younger rather than those who are older, who had less likely of a chance of surviving. In conclusion, there are many ways to combat ageism in healthcare. Believe it or not, we can start with ourselves by educating our youth on the importance of respecting the elderly. And we can also call on an increase in training for medical professionals working in geriatrics. Unfortunately, many elderly people still have to combat ageism in healthcare, especially today during the COVID-19 crisis. There is no doubt that nursing home staff tend to get far less PPE than staff in the hospitals, even if the nursing home has tested positive for COVID-19. There are ways for younger people to combat this as well. It is very important that younger people respect elderly social distance and try to wear a mask as much as possible. Finally, we all hope to be elderly one day, so we should treat everyone how we would want to be treated in the future. And finally, this is my works cited list. Thank you for listening. I hope I was able to help you understand the importance of this issue.